Well, hi everyone, and welcome into Pushing the Limits. Today I have the wonderful Dr. Melvin Nario to guest, and I'm super excited. Welcome to the show, Melvin.
Hi, Lisa. Thank you for having me. Always a pleasure. And I've met you in our webinars before, and I was amazed by your story. That was your mother, you. There's so many things that you have gone through and very resilient about it. So
Oh,
salutes to you and your mom.
thanks, Dr. Melvin. That's really kind, and it's thanks to wonderful people like yourself, and learning from people like you and Dr. Bill Clearfield, who's a hero who's been on the show before, and who I know that you work with, and it's people like that that have taught me along the way, that have been wonderful mentors, whether they knew it or not. So, and I'm really excited to share a little bit of your experience today because. Obviously, Dr. Bill speaks so highly of you, and you've got an incredible breadth of knowledge in the integrated medical world that really is quite fascinating. Can you just give us a little bit of a backstory where you came from, what you did, and how you got here?
Oh yeah. So well, Lisa, of course, I actually grew up in the Philippines. I did all my medical studies over there and graduated over there as a medical doctor. That's why I currently hold a license there as well. So I'm dual license here in the States and also in the Philippines. And I went over here. So my pre-med was actually a nurse. I was a nurse. I was a nursing student, actual registered nurse, and actually I became a nurse practitioner also, and then decided to pursue again my training here. I did my training in University of North Dakota, and that was my internship really started in Bismarck, North Dakota. That's for family medicine, and that's when I kind of found out really where my path is, because there was one incident there that we had to do rounds on a patient, and it's a patient who has migraines. And all my core residents, they of course are attending, was asking, "What is your treatment for this person?" Everybody said calcium channel blockers, all the prescription medicines. I came to me like, oh, let's probably give her melatonin, or maybe some magnesium, or even just like teach her not to use her phone at night, right? And everybody's looking at me funny, thinking that where did he get all of these crap?
Two
And
heads.
right, so I was telling them you probably should read about melatonin and magnesium, and maybe you'll get a thing or two about it. But
Yeah.
I guess that's one of the little sparks in my life that I knew that I think I'm going somewhere else and where you guys are going,
Yeah.
right?
Oh.
So, but then after that, yes, now I ended up in Las Vegas doing primary care. And there, and Vegas, I don't know if you've been there,
Yep, I've
but
been there.
right? It's Sin
It's
City to the
crazy.
max, meaning a lot of vices, food's cheap, nightlife with your friends, a lot of, and the workplace that I was in was very stressful. We were seeing like 40 patients a day. And this is
Wow.
regular medicine, right? And it was, of course, we were playing doctor within each one of us because my colleagues there are my doctors too. And it's time for our annual blood work. And of course, he kind of like sat with me and told me, "Let's go in a room. Let's talk about this. Hey, let's just talk in the lunchroom. Talk about my blood test. What are you talking about?" No, it's a little serious. So it came to the point that he told me that your liver enzymes are pretty elevated. Your blood pressure, we took it, it's a little high. You now have fatty liver, and
Well,
of course, you're pre-diabetic. That became kind of like the turning point for me. Now I am actually sitting on the other side of that
wow.
table. I
Mm.
was now the patient, and he said, "We need to start doing medicines. We need to give you these specific blood workups. We're going to see you in 3 to 4 months." It was just like a whirlwind of things to me that I can't believe it. I was
Wow.
avoiding this before, and now it's me.
Wow.
So the thing that I did was I called my aunt, who was actually one of my mentors, Dr. Ibarra, who is in Reno, Nevada, and I told her my situation, and she said, "Come over. There are things that are out there that you don't know about that you will be surprised that it will actually reverse what you have, and these are
Uh-huh.
not your medicines." During that
Hmm.
day, it was a shutdown, packed my bags, split, and went to Reno, and I guess it was history. So now I don't have all these medical issues. I was 180 pounds in Vegas. Now I'm basically 140, lost all that weight. And I tell everybody, this is the best that I've felt even when I was in my 20s or 30s. And I couldn't explain to you guys why and how, but it's just a totally different feeling compared to when I was younger.
Wow, that is quite a story. And and this is the I thought you were still in your 30s by the way, so you must be doing pretty good.
Oh, thank you.
Um, that would be the point that normally people get put on polypharmacy. You know, when you get fatty liver disease, you're overweight, you got metabolic dysregulation, insulin resistance, pre-diabetes, diabetes, all of those sorts of things are coming your way. Then it's 1, 2, 3, 4. This is where the track leads. When you went to Nevada, which is a state that has a lot more medical freedoms than your average state, I believe, in America, when you came across the integrated functional medicine world, for the whatever you want to call it, what was the shift in the paradigm thinking? You know, like, I mean, obviously with your migraine patient, I'll tell you a quick story. I was in the hospital with mum. She was having a gastrointestinal bleeding and whatever. There was another, actually a cousin of mine in there who'd been in there for weeks, and she was extreme pain, cramping like no tomorrow, like really, really bad, and they could not work it out. Like, and I'm like, have you had any magnesium? You know. And melatonin, and have you had magnesium especially? And she said no, and I said, well, I came in and I bought her some magnesium. Within 2 days she was out of hospital. They've been working on her for 3 weeks, you know, like
Wow.
as basic as magnesium deficiency, right? And it's
Well, we
like,
probably went to the
wow.
same medical school. That's what we look.
That was a shocker, right? And it's like that wasn't, you know, that wasn't rocket science. That was just basic. But
Well, you probably made the surgeons lose some money there for their college funds for their kids. So sorry for them. You found out the real treatment.
I'm not very popular up there, I can tell you. And not just for that case, but you also did homeopathy. And homeopathy, I must admit, I don't have a lot of knowledge on, even though I lived in Austria, you know, where it's big. Um, but I've been getting a bit more fascinated by homeopathy. Can you give us an explanation of what homeopathy is and how you integrate it into your practice? And has it actually got anything? This is just my connection of the dots. Is it anything similar to peptide therapy in a way? Because it's a
Yeah,
small
that's true.
dose of
Good question.
telling the body to make its own thing. Yeah, give me a bit of background on homeopathy.
Yeah, so Lisa, homeopathy is actually, so I actually am certified in homeopathy, and I'm actually currently the vice president of the homeopathic board here in Nevada. The thing with homeopathy is really it's classified as an energy type of medicine in the sense that you have what we call tinctures, and you dilute these tinctures, which are basically coming from herbs, minerals, and so many different animal extracts even into the smallest possible dilution that you can get, to the point that when you actually analyze these tinctures, you can't even find the molecule
Wow.
of physical molecule of the item that you put in there, because now what's left is in the energetic presence of that molecule is what's left. And this is where the rule of the smallest dose given to a body will actually respond better versus the allopathic model of giving higher doses to actually treat an illness. And this is where the problem lies. I'm not saying always with allopathic models, is because when you give higher doses, of course, higher side effects. In homeopathy, the smaller dose you give, the smallest stimulus to the body would be enough for it to heal on its own, and actually not the medicine that will do the magic, but it's really more of the smallest molecule will stimulate your immune system, your endocrinology system, the neurological, even the reproductive, all of these things. It's just like you flick your finger and let that echo, let that resonate throughout the body. You don't have to punch somebody so that you can actually make them feel the pain and the effect of that. So this is gentle, harmonic in terms of therapy, and it does not only address the physical issues like allopathy is. It's really affecting also emotional,
Mm.
spiritual, and even psychological. Because when we give remedies for homeopathy, we're considering even the behaviors of the patient, the patterns of symptoms. And that's why it's a very complex approach. People think that, oh, it's only herbs, right?
Mm.
It's really not. There's something deeper to homeopathy. And again, as you ask, how did we integrate this in our practice? Is as the advantage of being integrated practitioners is we definitely do not forget the basics of our doctorship, as we call it, that we always focus on physical exams, history taking, but everybody's always affiliating us with prescription medicines. And the beauty of this is when you give prescription medicines to a patient and you give them homeopathy, they do not have bad interactions. They can actually synergistically work together in some way.
Mm.
That's
Mm.
why when you say, how do we apply it? We apply it in so many ways. When we want to detox a patient before we want to start the prescription medicines on them, or if we want to use lower doses of prescription medicines and might as well use homeopathy to fill that gap up to help the patients. So there's so many different ways in how you use it in our practice. And going to your question about what's the difference between a peptide and also homeopathy is you're right. There are similarities. They work together in a sense that well, you can use them together, actually,
Mm-hmm.
and they both work by stimulating natural processes. It's not superseding or adding something to your system. The difference would be is, of course, peptides would be more of something manufactured in a compounding pharmacy, for example. Homeopathy, it's actually also it's not compounded in a compounding pharmacy, but in a special what we call homeopathic pharmacy, where they
Mm-hmm.
have these specific dilutions, succussions, specific procedures in how you prepare them. But you're right, all of these methods are still inclined with integrative medicine, which are all focusing towards the betterment of the patient.
And also the messaging, like letting it's giving the body a little bit of impetus to actually create its own healing process. Like with peptides, is sort of how I understand it. It's sort of giving the instruction manual, if you like, back that you maybe had when you were younger. Let's take, say, thymosin alpha 1 or something like that. You're getting sort of the
Right.
immune function back that your thymus would have given you when you were younger, but you're now giving sort of that instruction manual back. It's sort of like the recipe. Here,
Oh,
go and
yes,
make
that's
go and
right.
make the protein sort of thing. So it's sort of
Mhm.
like
And
a
with the peptides also, you have to remember that this is something innate in our system.
yeah,
And as we get older and older, this actually is decreasing in production. With
exactly.
homeopathy, this is something that is not part of our body. This is something external.
Right.
And one of the things that I apply in concepts of applying peptide therapy to my patients, I mean, most of the peptides, this is what I do, is I want to make sure the body is clean, the body is stable in order for that peptide to actually be used on a patient. So if peptide therapy is not my first line for patients, I need to detox them. I need to
Mm-hmm.
make sure I optimize and stabilize any abnormalities that I see in their labs. And when I feel that when the body is ready to receive it, it actually now is going to be your second or third tier to optimize the function of the system. For
Mm-hmm.
homeopathy, it's something that we can use as first line because it
Wow.
actually can help acute conditions, for example. I mean, acute conditions are also there for peptides like BPC 157, for example, and even thymosin alpha 1 if you have an acute infection. But again, but as you can see, homeopathy can be started now, but for peptides, and they're not cheap. I tell patients you need
No.
to clean the house first so that you can optimize and maximize your peptides.
I love that. That's a very, I mean, even with like, a hyperbaric oxygen clinic, um, I've learned from Dr. Scott Scher, who's a hyperbaric physician, you need to prepare the body for the hyperbaric before you actually, ideally, if it's an acute thing, maybe you're getting straight in there, but ideally you're giving them the nutrients, you're giving them the supplements, the lifestyle interventions, the things alongside that hyperbaric so that it actually can do its job optimally. And it's the same with the peptides. If you bring in the advanced stuff, but you haven't done the foundational work, you're going to, not get the full benefit at least of what you're doing. And as you say, peptides and indeed hyperbaric is quite expensive. So you want to be doing the foundation. But sometimes that's quite hard conversation with clients because they just want the one thing. They want the one thing, the quick fix, the magic pill or the
Well, I
magic
mean, the
therapy.
people will pay for it, Lisa. I tell you, it's just that you have to be honest with everyone that, hey, you're paying this much money, you better make sure it works. Just because we don't, of course, our reputation, our name comes along with it, but it's really your body, your system that's going to benefit from it and who's going to be using it. And I have, for example, even stem cells or exosomes. People likes to get those. I always tell
Yeah.
them, sure, you want to get that? You want to make sure you detoxify. You want to
Hmm.
make sure all your minerals, all your vitamins, all your nutrients are up to the par where all of these new cells that are going to be coming in will be happy. Just like little kids you adopt, right? You want to put them in there, or you have new kids coming into your house. You want a clean house. You want everything conducive for them to grow and just be good citizens in the future. Same for your stem cells. Make that house happy.
Yeah, that makes so much sense to me because yeah, I think we all get caught up in the shiny object syndrome and the cutting edge, the fun stuff, the sexy stuff, but actually, all doing the foundational stuff, the harder work before you get to the fancy stuff would make a whole lot more sense in a lot of cases. And like cleaning up your diet and cleaning up your exercise and getting better sleep. If I'm doing some fancy exosomes and stem cells, but I'm not sleeping. I'm just throwing money down the toilet. Like it's not going to be really as effective as it could be anyway. So I think that approach is a harder sell because they just want the thing. But I think that's a much better approach. And you also are quite unique in the IV therapy world. So there's lots of IB clinics now that are doing, vitamin C's, which I do, for example, IV vitamin C. Um, there's glutathiones, there's other things, but you've taken it to the next level in IV therapies. Can you tell us a little bit about your experiences with that and what you do?
Right. So you probably are, Lisa, you're very familiar with the one-stop shops out there. The hydration bars,
Yeah.
yeah, right, the beauty IVs out there with the aesthetic practices. What we have integrated in our practice is actually a protocol of IV therapies that we have done for almost 30 years. And these IV combinations that we have had actually been proven through time to be our bread and butter. And this IV protocol that we have focuses on not only detoxification, but also repletion and also stabilizing the cellular, I guess, energetic needs. And this is, it's not just like when people come here, hey, I want vitamin drips. Sure, we'll just give you and bounce you off with so many vitamin drips. We actually have a specific protocol for them. And these IVs actually focuses on different things. For example, pH balancing. Another one would
Hmm.
be liver detoxification.
Hmm.
Another one would be biooxidative therapies. Another one would be chelation therapy. And another one would be mineral and vitamin nutrient repletions. So those, and even now we have added to our arsenal UV blood irradiation. Uh,
Wow.
yeah,
Okay.
and this is ozone
Yeah.
and Ibu therapy. We now have in our arsenal to the point that this is now mixed also with our other devices that we put our patients on. So we have scalar fields here. We
Mm.
also have PMF, and you would notice that our patients are actually doing multiple things when they're sitting in an IV room. That's why it's not your regular IV bar, for the reason that while they're sitting on that IV chair with their IV dripping, IV bag dripping, they're also being surrounded by what we call our outer energetic accessories, so that we can actually increase the distribution of these IV fluids and maximize and potentize the capacities of these IV therapies. That's
Wow.
why this is the beauty of being in Nevada. Being in Nevada,
Yeah.
practicing what we call homeopathic or integrative CAM medicine with the board that we have, and this is basically allowed by our state to be practiced safely by professionals like us.
Wow. That is next level because there is nothing like that here in New Zealand, like nothing. Like we have IV vitamin C, if you're lucky, maybe glutathione, maybe that's pretty much it actually. There's not much else.
That's it.
Hydration maybe. But and even like I've been trying to open up an IV vitamin C clinic, and I have the accounts. I have a doctor overseeing it, but I don't use it yet in my clinic. I only use it for my mother at the moment. Um, and it's just like so much rigmarole and so much hoops to jump through that everything has to be completely tightly controlled. There is no talk of anything like the customized IV that you put together with botanicals and minerals and all that sort of stuff. And there must be a real art to that. You have to have a very skilled doctor that could put that sort of stuff together. How did you sort of get to that sort of a level of expertise, if you like? Because that is really quite unique.
Well, when I started in the clinic, I actually was, of course, an employee here, and I started from the bottom. I actually started as front desk because there was just nobody working through that. And as I rotated myself around the facility, I ended up having a liking for the IV section of the practice. So that's where I kind of focused on my I guess my abilities in terms of enhancing it, because before we were just doing one single IV at a time, the regular hydration bar
Yeah.
deal. But once I saw the potential of these specific IVs that we have and more that we can add to that, I actually got special training. So here's the thing. I was being doctors, we're actually so locked in our box, seeing that, oh, other professions, we can't learn from them. We're like on the top of the hill. The
Yeah.
best education that I got about IV therapies are the naturopaths.
Wow.
So I have so much respect for them, to the point that I every protocol actually of our RV room here actually was related to what they have, because you can't find MDs or DOs doing, maybe you will, but really majority of the knowledge are coming from the naturopaths. And they even taught me how to infuse botanicals. So you mentioned botanicals,
Mm.
curcumin, quercetin,
Wow.
resveratrol, and
Wow.
even melatonin. And these are things that we have been doing here for like years, and have been
Wow.
helping patients, especially cancer patients, because later on, maybe I can tell you more about that, because there's just so much genetic assistance now or help for these cancer patients. And even in the IV realm, there will be what type of IVs will work for you best, and this will be the one. And this is the pride and joy of what I do, because I actually do my own IVs. I insert my lines to my patients. I mix my own bag, even though I have a staff, but I definitely go to war with them every day. And also, I myself, I have to walk the talk. I get my own IVs. Before an IV is given to a patient, if we have a new one, it has to go through me, because I will need to know if it's safe, number one, and number two, if it's going to be tolerable for the patient. So
Yeah.
I have failed, I have crashed, I've hurt myself so many times. Thank God I'm here talking still. And I've done my own guinea pigging on myself with
Yeah.
these IVs. So,
Brilliant.
but yeah, and now yeah, all my veins are like, I guess, inserted on. I don't have a free vein anymore. Everything got poked.
You'll have to get a portacath or something at some
Yeah.
point. I have a portacath for mum, and it's a godsend, I can tell you, because at her
Oh,
age
wow.
with
That's
cancer and
amazing.
things, yeah. So that's the only way that I've been able to continue. Like we've done IV vitamin C, but only vitamin C, but for 10 years. 10 years, and I credit that to being a big part of her surviving, currently her cancer situation, which she doesn't have it at the moment. So, and recovering from her aneurysm and stroke that she had, and just keeping her immune system going, and so we do that weekly. And I was doing it like even 3 times a week in the when I was in the depths of war against cancer. And it's a powerful, amazing thing, and I wish I knew more and could do more, and there were more things available than just the vitamin C, because what I'm seeing even in myself and in many clients, if you you might be putting in the best supplements out there and the best food, but if you're not absorbing it for whatever reason, and there can be many reasons why, um, then you're not getting the full benefit of those supplements, right? And I think there's a problem with our gut health in general, and our ability to absorb as we get older. Of course, our ability to uptake our nutrients from our food, our stomach acid goes down, our digestive capacity, our microbiome is often disturbed, barrier function is often not so great. All of these things, I think, are having an impact. And even when you're putting in the good stuff via the oral route, it's not necessarily getting one for one to where you think it's getting to. And that can be a problem. And this is where I think the IV therapies, if they were allowed to flourish more, could be filling that gap. And we also need to keep working on the gut health piece of the puzzle, which is hugely important. And what I'm doing with my company and my biotech company that we're just getting our flagship product to market shortly is working on the immune system and working on gut barrier integrity and things like that. But it is, I see that again and again, that sometimes, and I've experienced it even on my own body, where I'm taking the stuff and it's not coming through on my blood work, you know, or then you've also got things like genetic abnormalities, like I've got, for example, the MTRR and MTR genetic mutations, which is in the methylation genes. I can be taking B12. It looks great in my blood cells, but I've got nothing in the actual in the actual tissues doing what it should be doing, right? So there are some reasons why we're not actually getting the thing. Would you say gut health is one of those issues?
Yeah, so that's a pretty good point that you brought up, Lisa. The thing that I always have kind of like challenges with is to how could I convince this patient to actually put in this much investment or money to actually pay for IV therapies or IV therapy protocols? The reason here is really it's actual. I've been doing it for that long. It's basically educating the patient to tell
Mm,
them that this investment is going to be worth your money. And how would you turn them around? The reason for that is, as what you said, everything that we take through the mouth is definitely not going to be going in as 100% equivalent. Everybody has dysbioses. Everybody has leaky gut. Even though you're like the perfect athlete, you're just doing all the right things. I'm going to tell you, there's some damage in that like microvilli in the small intestines, and it's not absorbing. You're probably going to have a little bloating here and there. You're burping, and whatever you're eating definitely tells me a lot already what's going on in there.
mhm,
And the best way and how I show them that is, of course, the blood testing. Whenever I do blood testing on them, even though the healthiest of healthies, when they see their blood test, oh my God, wow, I didn't even know I have inflammation like this.
mm,
I have
mm,
HSCRP that high. And it's all going back to the basics of how you differentiate yourself from the world out there into your profession. Because people would just say, hey, you go to a vitamin store shop and they tell you you need this, right? For us, yeah, you need this because we have a test that will actually tell you that this is what's going on. And you have a good point a while ago that, yeah, sometimes it wouldn't show in testing. That's the reason why we have special testing. And the
Mm-hmm.
special testing that we have are the functional tests, like
Mm-hmm.
micronutrient testing. We
Mm-hmm.
have heavy metal testing. We have hormone testing, which are not covered, unfortunately, by insurance.
Unfortunately, yeah,
Right. And
exactly.
that's where we kind of change the game a little bit there. But I always want to tell patients that this is not a medicine that only is very particular about people who has money. There are ways really on how we can still help you, even though there's some financial struggles or challenges for you not to obtain these specific tests. Because when for us, we actually have connections with these companies and tell them, hey, this person, he really needs it. And we need to test him, but we don't have the funds for him. So they will actually make payment plans for them just to
Wow.
facilitate just hearing from the clinician that it's really necessary. And that's why I want to put it out there to everybody that everybody has access to integrative medicine if you really want it. That it's really more of the heart, right? If you want to fight for it, if you want to be proactive about your health, please do. Just because
Yep.
don't listen to your doctors who just take this is the remedy for you, and this is the prescription. We'll see you again in 3 to 4 months. You
Wow.
need to find out what are you taking. You need to find out what are the side effects, and you need to find out I need to learn more about this. There are other people who can actually help me if you want that better approach. But you're right. Again, going back, gut health is very important, and I can talk about it all day.
Yeah.
But that is one of the bigger reasons why we have a dysfunctional society right now. And you have to remember, we are not deficient in protein. Everybody's so focused on protein. Oh, give me that 1 gram per kilogram per day. But the society here in the US specifically, we are deficient in fiber. So you
Yeah.
ask a lot of our people
Totally.
here, constipated, right? So that's a
You're
story
preaching
right
to
there for you.
the choir. It's, like got a brother who's just, so focused on protein and muscle and he's, fabulous physique and stuff and, in his 50s doing great. But it's like, you need your fiber, eat your veggies, get your why do I need that stuff? I need more protein, more protein, more protein. No, you don't need more protein, need your veggies.
Well, that's
We
why our
have that
toilets here
argument.
are clogged.
Yeah, like we just had the lovely Dr. Ross Pelton on my longevity group, doctors group this week, and of course he talks about the diversity, the Amazon rainforest. You need to be eating a diversity, not just the amount of vegetables that you're eating and fruits and vegetables, but the diversity. So, and we have a very narrow things in our supermarkets now that we all eat the same type of broccoli and the same type of, whereas in our past our ancestors used to forage and used to have lots of small amounts of lots of different things, and that created a microbiome that had all this beautiful food for our bacteria in there, and that would create beautiful postbiotics that made us happy and better, short chain fatty acids and butyrate and all of that sort of stuff. And it's not just the probiotics. Is what I took away from Dr. Pelton is the postbiotics most importantly, not the probiotics, as being that key thing, but that diversity of the food. So now I'm like, okay, right, I'm going to go out and I'm going to get a little bit of this herb and a little bit of that lettuce and a little bit of this, and I'm going to chuck it all into a smoothie, and doesn't taste particularly great, but the smoothie I just had this morning, but I've at least start my day off with a good bang of fiber and a good, and I think looking after our gut health so that we can absorb our nutrients and we can, work on that. Now, I wanted to swap gears a little bit and talk cancer, because you've done a lot of work in cancer. You've worked at the Forsyth Cancer Centre, and you do potentiated, what do you call it? Insulin potentiated
Low dose.
chemotherapy, low
Yep.
dose chemotherapy. You do RGCC testing, which I'm a big fan of. Can you talk us a bit a bit about that experience and working with Dr. Forsyth and the team there, and
Yeah.
cancer?
So yeah, this is actually a an honor to be invited by the man himself,
Yeah.
and he's actually Dr. Forsyth. Don't throw rocks at me. I think he's 85 now.
Wow.
If I'm putting the numbers wrong here, but
Hmm.
he's still active. He's doing it. He's still practicing, and the man is
Wow.
just unstoppable. And
Wow.
how we started really was I was just walking around a conference room, a conference hall, and he saw me like, "Hey, you!" It's like pointing at me. Me? Yeah. Hey, you want to go to my clinic? Like, do you even know me? Yeah, I've been seeing you in the conference for for some years now. Yeah, go to my clinic, come with me and see what I do. And I know who he is. He didn't know who I am, but I went there and then I just suddenly like saw the awe and on what this cancer facility could actually do. We were seeing stage 4 cancers there
Wow.
that actually are given almost an average of 10 years extension of their lives.
Wow.
And
Wow.
these are patients that were actually seen by their providers saying that you only have months to live now, unfortunately. But with the IPT and with all the, oh, of course, it's not just IPT that we do. We also do other, for example, interventions like pH balancing, nutritional interventions, and even later on, I can discuss with you also what we call the SOT. And
Yeah.
this actually had led towards that result. And here's a fun fact for everybody. US and Australia actually cannot do any 10-year longevity study for stage 4 cancer patients. Why is that? Because when
They
they
don't
give their
survive.
therapies, they're done. The only one that they could actually, I guess, scour through the literature is 5 years overall survival for the
Wow.
stage 4 cancers doing full dose chemotherapy. And to be
Wow.
specific, United States has like what, 2%, and Australia also 2.3% in terms of how far they can take these stage 4s. On our end, we actually had done this in terms of like a 55% overall outcome in the studies that the cancer center had done. And that actually tells you that this encompasses all of these specific cancers, not only just the common ones like the breast, the prostate, the lung, but these are inclusive of all the cancers that we have seen there for that long. And that's why,
Wow.
yeah, the low dose chemotherapy is one of the key factors here why they are responding that way. And just to like give our viewers a preview of what that is, and also for you, Lisa, is we actually use the power of insulin in
Mm.
relation to utilizing that cancer cells hunger for sugar. This is called anaerobic glycolysis, that they actually process or use sugar as energy for them to multiply, proliferate, and we deprive them of that by dropping the insulin levels and injecting, of course, giving it to patients. And as the sugar drops, now the actual chemo drug, which is low dose, will be given to the patient and will now be absorbed by these cancer cells like a sponge because they're so hungry. Hey, I would
Mm.
anything that would get into the system. And that's why this is more of a targeted therapy that is preferred by patients for the reason that the side effects are less. You have to remember that majority of side effects of chemotherapy is because they're killing normal cells as well. And with normal cells, when you deprive them of sugar, they still have their lunchbox saying, "Oh, I'm good. I still have my sandwich here." But for the cancer cells, when you deprive them of sugar, they're going to be like, "Hey, I don't have my lunchbox. I don't have the facilities to keep myself surviving. I'm just going to consume whatever that's coming in." And that's when chemo hits them and actually kills them in that whole process. So it's like a
Yep.
Trojan horse story. That's maybe a better
Yeah,
analogy.
I love it. And I'm just like, why is this not everywhere? And I think it originally there's a clinic in Mexico that does it. I know Dr. Minkoff does it at the LifeWorks Wellness Center in Florida. And it's like it's a small dose, like 10 to 15% of the normal chemo strength, but you're using insulin and cancer's hunger for sugar. And
Mhm.
like we standard doctors know you do a PET scan And that shows you where the cancer is, because the cancer's sucking 20 times, 10 times the amount of sugar into those cells. So we know that they're eating sugar like no tomorrow, or carbohydrates, right? Like no tomorrow. So would it not be sensible to cut off sugar out of your diet for starters? And yet when we go to the chemo place here, you know, with mum years ago when we were there, they're sitting there having their cakes and their orange juice and their Coca-Colas while they're getting their chemo. And I'm just like, what is wrong with this picture? And then, you know, the oncologist says to mum, or the hematologist in our case, says to mum, oh, Isabel, you've lost a kilo. I want you to make sure you eat your pudding on your way home, you know? And I'm like, and mum looks at me like, yeah, I wish. She's
It's
never
not
had.
different from our cancer centers here. They offer
Shocking.
donuts in the waiting room in the
Yeah.
oncologist's office.
Which is what's caused this problem. And well, you know, part of this problem, but it's certainly when you have cancer, you want to, yeah. So I've released a book called What Your Oncologist Isn't Telling You. And it's an provocative title, but it was after this experience of being told by our local oncologist when mum had her CNS lymphoma that she was dead. There was nothing we could do, absolutely nothing. She was 80 years old at the time, and you know, what do you want? Nothing we can do. And so I went and I did RGCC testing, which we will get into in a minute. And then I worked out I couldn't get the insulin potentiated chemotherapy, so I had to. And because hers was end stage, got weeks to live situation, I went both sides of the fence. I went chemo, I went immunotherapy, I went metabolic approach, everything, chucked the house at it. I had to go private oncology. I had to go running around the country with a very sick mum to convince them that I needed temozolomide, because that's what the RGCT test told me, and I needed rituximab. And this kind oncologist over in another part of the country said, yep, I'll get that for you, and I'll make sure that the guys back in your hometown give it to you. We had to pay privately, etc. I got what she needed. And then we did the whole metabolic. Most importantly, we did the full-blown keto diet. We did the peptides. We did hyperbaric. We did IV vitamin C 3 times a week. And within 12 weeks, the tumors, which covered half of her brain, the whole right side, left side of her brain was just, cancer gone. And we're 3.5 years in now. And I can only tell on an MRI. Unfortunately, there is no other test that I can do to measure it, unless you can tell me of a test, because I know there's some tests coming out with circulating tumor cells and things. I don't know. But that means that only, like, when I can pay for an MRI once a year or so, I can actually see, are we still winning the battle, right? Because otherwise I'm flying blind at most of the time, which is scary. And just to share that story. And I think that insulin potentiated chemotherapy is a really amazing approach, and just makes a whole lot of just logical sense without even knowing a whole lot of, how the whole thing works. But insulin gets sugar into the cell, for those who don't know that. And so when you give that with the chemotherapy, it's going to go into the cancer cells specifically and spare the other cells, the healthy cells that you don't want to have chemo, which is, where all the side effects come from. One of the things that I've been dealing with mum since she had the temozolomide, and I only just last week found out that it comes with DMSO. I've forgotten what the acronym is. And she's been dealing with normotensive hydrocephalus since then. And I think that's probably the one thing that temozolomide may have caused is the hydrocephalus, maybe in conjunction with all their previous brain injuries. And that's the one thing I haven't been able to get on top of. So that means that her vestibular system is very impaired, which is really tragic, because everything else I can fix. But the water on the brain situation, not so much without a surgery, and the surgery is too dangerous for her.
At her age, that's really kind of treading water there.
Yeah.
It's just that, but yeah, I agree with you. And DMSO is something that we use also in the facility.
Yeah.
It's methyl sulfoxide. and it's
Yes.
something that is being, yeah, it can be used as a part of an infusion, but we use it more for, of course, it's an enhancer of absorption. So when you use this with other IVs as well, it actually amplifies their action to go into the cell, and almost like doubling the dose, multiplying the dose. And I've been using it for so long here in the
Yeah,
clinic
there's
that,
so many good things because I was
yeah.
researching DMSO to actually maybe help her with the hydrocephalus. And then I realized, that was in the temozolomide, and maybe that's actually contributed in this case because we put it with chemo. Not that
Uh,
DMSO on itself is bad, but
mhm,
when it was used for the chemo to potentiate or whatever they use it for in
mhm.
the chemo, that could have, and I'm joining my own dots here, but that's what the studies are saying that could have, yeah, that could be a cause of hydrocephalus. Um, yeah, but DMSO is actually something also very interesting, isn't it? Like you can use it in a very positive way for everything from joint pains to, yeah, well, you tell me what DMSO.
Yeah, so we use it a lot for inflammation in general,
Yeah.
and we always have this at hand for people who has like chronic pain, even just yeah, people who are actually just inflamed from their chronic illness, for example. And again, it's an enhancer. We add it to our other IV bags, for example, nutrients and vitamins, so that these vitamins and nutrients can be just absorbed rather than you just peeing it all out.
Mm-hmm.
There's a catch though. It's a
Mm.
sulfur product. When
Mm.
you're done with this, you're gonna be smelling like garlic like crazy.
Yeah. Yeah.
And I don't know if you've experienced that, but we have patients here that are for 48 hours. They're just stinky.
Yeah.
They go to the shower thinking that they can rub it all off, and I tell them, nope, it's from the inside. You cannot remove it. You're going to be probably the most unpopular person for 48 hours.
But who
And I
cares?
have
You know,
husbands
like.
get kicked out of their rooms by their wives just because of this. And but hey, it's good. It removes
Yeah.
all the pain, all the inflammation goes down, but the catch, you're a little garlicky.
Yeah, and you can use it as a topical too, can't you? It does go through
You
the
can.
skin very well. So
Mhm.
if you've got sore joints or arthritic joints or anything like that, it can be beneficial, the DMSO.
Yeah, they actually mix it with other remedies also in order for that remedy to be absorbed faster and
Mm,
better. That's
mm.
why, yeah, and there's another precursor that the MSM. I'm sure you've heard of MSM before.
Yes, yes, I take
Yeah.
it. Yeah.
Right. So that's also another type of DMSO, but the preform
Right.
of DMSO. So it's
I
almost
was
similar.
wondering that because I was like, huh, what is the connection between MSM and DMSO? I couldn't work that one out yet, but so it is a precursor to
It's a
DMSO.
precursor. Hmm.
Right,
Hmm.
right. So that's why, with the sulfur and, or, and sulfur like garlic, like we all know if we've eaten garlic, I do give mum a garlic extract, and I come in the morning in a bedroom and it's like, whoa.
Talk about bad breath.
Yeah, but hey, whatever works. I don't care as long as it's helping
Yeah.
her. And is it is it a garlic like, garlic has sulfur in it. So is it got the same sort of properties of DMSO as the garlic?
Uh, it's really more not really. It's an extraction of such. They
Right.
just have sulfur products that are the same, but garlic definitely has its own. Like allicin is the one that actually is the extract of the therapeutic benefits of garlic, and that is not found in DMSO. But garlic, I use a lot of that, especially black garlic,
Ah.
for increasing nitric oxide. So this is something that
Oh,
now actually supports hydrogen sulfate. It's another pathway that actually increases nitric oxide.
wow.
And we always know about the two pathways, the arginine
Yeah.
citrulline pathway, and also the nitrate nitrite pathway.
Mm-hmm.
But this one is another pathway which actually is being utilized by a supplement company here now in the US to
Oh.
increase and boost nitric oxide. And of course, we have aged Kyolic garlic. And this is the
Yeah.
one that we actually benefit from in relation to treating our cardiovascular problems like
Yeah.
hypertension, cholesterol. And yeah, yeah, there are products here, but there's one company that's one specifically that I recommend to patients. But yeah, that's why all of these powerful benefits from garlic is there, and it's underutilized. We have to use it a little bit more, and hopefully we get the voice out. And I know you have a lot of products related to nitric oxide there,
Yeah,
so
I do.
it's definitely
Yep.
something worth being heard.
Yeah, I'm a big fan of optimizing your nitric oxide pathways. I had Dr. Nathan Bryan on
Right.
the podcast, and his nitric oxide lozenges are very successfully with been used with a lot of my clients for things like Raynaud's, for just circulation problems, blood pressure problems. But I didn't know about the black garlic as
Hmm.
being another pathway, because I knew those two pathways, and the arginine pathway I don't use because I think that's unless you're a young athlete, you might benefit from an arginine pathway, but can have sort of detrimental effects really if you're older and got an uncoupled NOS.
Hmm.
So I use the nitric oxide lozenges um, preferably, but I'll have a look into the black garlic. That's really fascinating. And now, like so you're working still at the Forsyth. You've also got BioEdge, which is your IV side of things that you do, and you're working with Dr. Bill Clearfield at the Clearfield Medical Group. Is that right? Yep. And
Hmm.
so and you're also in the Philippines. Now tell me a little bit in the Philippines, you going backwards and forwards, sort of because I know last time we spoke you were actually in the Philippines.
Right.
Where are things at in the Philippines? From like where I'm interested in different countries and their medical approaches because, New Zealand, we're in the dark ages and a lot of things. Nevada's very advanced. I know places like Colorado and Florida are quite advanced. What's it like in the Philippines as far as medical freedoms and things go?
Well, with the Philippines, they have actually. I mean, I'm not saying it's always a win-win here in the U.S., the land of the free and the brave, where everything's here. Not really. But
No.
when you go to the Philippines, for example, there are things that you could actually use over there that are not here.
Mm.
A good example for you be homeopathy. There's a lot of homeopathic selections compared to here. Recently, there was a ban here of homeopathic remedies that cannot get into the states, which are still available in the Philippines. And these are
Wow.
very potent homeopathic remedies that we have used for 20, 30 years and seems to be very effective. So that's one. I can use them over there. Another one, I think we have mentioned a while ago, peptides.
Yeah.
Peptides here just suddenly dropped a big ban. FDA dropped a big ban on so many
Tragic.
peptides that our practitioners came out scrambling for the next best thing that could replace those that were banned. But over there, they have this freedom to still use it. Like I mean, Thymosin Alpha 1 has now been there's our band that we got removed here. We can use it again. But other guys such as like your Celax, Cmax, those are the nootropics that we have.
Yeah. Yeah.
And even yeah, so even for the apomorelin, tesamorelin. So all of these things are kind of like still 50-50 here, but over there you have this ability to use all of those. And
Wow.
the best thing about, I guess, when we talk about integrative medicine, and we mention about the costs that are involved in relation to getting these therapies, it's cheaper over there. And
Wow.
that's why when
Okay.
I go over there, I appreciate the fact that I can deliver my services to people who can afford it. Because I have a lot of challenges here in the States that,
Yeah.
oh, it's too expensive for me and not in my budget. But when you go over there, they actually have a better I guess, presentation of this to the point that people have actually grasped preventative and integrative medicine as part of their regular medical, I guess, specialties that they seek there. And then also, the beauty of being in the Philippines, it's a tropical country. Here in the States, here, like for example, here in Reno, we don't have much greens here, plants. There you have what we call environmental medicine. We're talking about grounding. We're talking about clean air that we breathe. Talk about organic plants and organic products. There's a lot of agriculture there. There's a lot of herbs. that you can
Wow.
actually use at your disposal. And we don't have that here being industrialized and commercialized here in the US. I'm not saying it's not present, but there's just more abundance of that over there. So, but again, the win, I guess the catch 22 here, the states, we have the up-to-date resources,
Yeah.
we have newer supplements, we have the newer studies, and that's why I'm working with this Filipino integrative organization for in order for us to bring the knowledge from what we have here over there, and that's where me and Dr. Clearfield have collaborated to educate this Filipino contingent in order for them to be updated, to be in the know, and hopefully up in the horizon, they can actually get into what we're doing and they get introduced as early as now. But again,
Wow.
it's something that's again totally different. They're still, of course, not having the same technology and advances that we have here. But hopefully we'll get there. And that's one of the things that I would like my countrymen to have, to also enjoy the benefits and resources that we are enjoying over here so that we can help more people over
Oh
there.
yeah. 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 I just feel the passion coming through, like I can feel it, and I understand it because I have that same passion for my country people over here, that I would like to see them get access to some of this latest and greatest, and that, and it's really cool to have some international collaborations like that happening, so that you can take the best of the Philippines back to the States, you can take the best of the States back to the Philippines, and have collaborations across with colleagues, and I've started a longevity doctors and allied health professionals group down here, and I actually had the idea from being a part of Dr. Bill's and your, American Osteopathic and Integrated Medical Association, and being a part and having the privilege of presenting and to you guys, and just seeing the power of that group, of having um, cutting edge presenters come in and talk about their area of expertise, but really it was the conversations that happened after the speech were what blew me apart, and the passion with which the people in that group operate, and I'm like, I want that here, so I started a group here. And we're small, and it's a grind at the moment because I'm trying to get people to join, and we've got a few dozen people that have joined, but then you got to get them to actually turn up on the day to listen to the speakers and so on and so forth. And I know, Dr. Bill's speaking, and I want you to come and speak on the group too.
Yeah, that'd be great.
You've got to start somewhere, right? You've got to start small, and work your way up. And the whole point of it is, like, we had a group here, the Australasian Integrated Medical Association, which was New Zealand, Australia, and that's now unfortunately closed its doors. There's a gap here for having this cross. I like to cross medical professions operate as well. Like, I'd like to have chiropractors and neurochiros and pharmacists and herbalists and naturopaths and doctors and everybody in the mix, right? Because we all bring different points of view, and that's where the magic. I mean, the first session I had Professor Edmund Leung, who is a gastroenterologist, traditionally trained surgeon, endocrine surgeon, but he's also done a PhD in microbiome. And then the naturopaths on the call, and then I had one of the experts in neurofeedback, and the exchange that happened at the end of the conversation was mind blowing, right? Because they all
Right.
had completely different points of view that were just like, wow. And I think even Professor Leung got something out of it. You know what I mean? It was great because you have this different perspective. And I think in a lot of medical facilities, especially in hospitals and stuff, there's very much, don't look outside the box, you'll be shot. Don't put your head above the parapet or it'll be
Right.
chopped off. And we got to get rid of that thinking, I think, and have As you said before, doctors, medical doctors, think of themselves often as the top of the pile and look down upon herbalists and naturopaths and and chiropractors and everyone else, and that's, I think, just silly, and not a good way to be learning from each other.
And that is key, Lisa, as you just mentioned that I actually have to admit to myself that my journey through integrative medicine is a humbling experience because I, I only thought I'm going to be learning through doctors. But along the path that I took, I've learned from pharmacists, I learned from chiropractors, I learned from even massage therapists that that was not taught to me in medical school. And some of these are actually sometimes not even medically related. Sometimes the more important lesson or gems for me are actually more of the values. How do they see patients with with respect, with how they relate, how they see eye to eye with these people, how they touch a person, how they apply healing hands on them. And these are things that you don't learn in the classrooms. And when you talk to these professionals, you actually humble yourself to the point that, wow, I thought I knew everything. But these
Mm,
are things that are gems that I could not get anywhere unless I actually see it in action. And
I
that's
love
why
it.
one of the things that also have learned from these mentors of mine that the one biggest resource that we are always forgetting, we're thinking of, oh yeah, I need to buy the newest machine, I need to get that newest supplement, but always the biggest resource is our patient. Our patient is the one that will actually tell us what's working, what's not working, and they're even going to tell you about life lessons that you don't know about that you actually yourself can even bring to your own personal life. And this is something that we overlook. We're so some doctors are so rude to patients. They don't
Mm,
they only want to spend
totally.
like 5, 10 minutes with them and just to learn their problems. But the thing here is really this is where the gold mine is. And I really want to re-emphasize to other doctors out there and even any health practitioners that these are the people that actually puts I guess food on our table, but I don't want you to perceive them as that, but they are actually the ones who will make us grow as individuals, not only through of course their financial I guess setbacks on us, but it's also how their stories lives into us, how it resonates through us, how we emotionally connect with them. And these are the things that I really want to see, even because I teach students. I'm a faculty member of A4M. And this is what I emphasize to them that these are the core values that a clinician should have. Not only this, but they also had this part of them developing.
Oh God, I just absolutely love that. I could just amen to all of that, because that is like when I'm working with my clients, like I am constantly learning and they are making me aware, and they send me studies and they like, what about this? And I'm like, oh, never come across that before. I'll have to go and research it, won't I? And I'll have to go and find out. And then so you're constantly being pushed by your clients to actually study and keep up in the know, and then they know something that you've never come across, and it's a co-learning experience. And I learned that word from Dr. Ron Honninghake at the Reardon Institute. Co-learning. We're learning together. I don't have all the answers. You certainly don't have all the answers, but together we may come up with some great plans, or we may know somebody who has a great plan, and we may, and that collaborative approach is the way. It's not that I'm sitting there, the all-knowing oracle of going to, now I'm going to impart my incredible knowledge to you. It's like, oh well, yeah, that's backwards and forwards, and I hate, the times when I've been in the institutions with mum and with my father as well, the arrogant consultants that come through sometimes with their entourage, and the way that they treat you as if you are complete idiots is shocking, shocking, absolutely shocking. And it's not okay in this day and age. It's not okay. I don't care how much pressure they're under. I don't care. They do not need to treat people like that. And and I'll fight that every step of the way, and I do, because like I've seen some shocking things in our hospital that just actually absolutely make me cringe, and um, especially when you've got elderly parents who you're fighting for their life, and been in situations where you're like, what do you want? She's old. She's, you can just see it in their eyes where they're just like, what a waste of time. Like, I'm not even going to bother. We had one consultant where she was had a gastrointestinal bleed and she was bleeding out, and we were talking about emergency surgery to take her entire gut out, basically, and trying to make this huge decision. And they'd actually taken a false blood test. The test had come back with a lower level than was actually there. That's another thing. But the attitude was like, she's not worth saving. She's got cancer anyway. And she's like, why the hell would I, and the way he talked to me, and it was like, you've probably caused this with your supplements,
Oh,
not
no.
knowing who I am, what I do, anything else. The 10 years that I've dedicated my life to my mother, and to come across like that. And I was, and you can't say anything because they've got the life of your parent in their hand right then and there. They're either not going to operate if you make a fuss, or so you're just hamstrung, right? You're just
Right.
completely and utterly devastated and can't say anything, and can't, so those sort of situations that I found myself in, unfortunately, a number of times, where I'm just absolutely, that's what drives me. That's what drives me to change and to create this education platform, and to learn from great mentors like yourself, because that arrogance has to be gone from our system, and we have to have a collaborative approach, and older people they're the ones that have brought us up. This is our parents. These are our people that are, they deserve our best.
Right. And not to justify my colleagues, but of course, yeah, doctors are people too. Of course, they have things to do, their own personal problems, but it's not reasonable. It's not justifiable for us to treat patients that way. And I do hear a lot of horror stories, but it just has to be brought out in the open, and they have to be called out for it, that everybody's equal. We are all human in this world, and we
Exactly.
all need all the heart, we need all the listening and emotions that we can get from somebody who we look up to and we perceive as our health provider, who will actually not only give us physical health but also holistic health, basically.
Yeah. Yeah. Dr. Melvin, you've been absolutely wonderful. I think that's a good place to wrap it up, our session today. Please, I'd love you to come and talk to my group, and keep learning from you, and to keep being a part of your wonderful group. And if I can be of service to you in any way, shape, or form, let me know. But just thank you for the passion that you bring, for the skill set that you've incredibly worked on for decades now. It's just absolutely wonderful. Thank you so much.
Thank you, Lisa, for having me. Always a pleasure. And again, we're always available here in the States for you guys. And any type of help that you need, always just contact us, and we're always going to be available.
Yeah, so on that point, where would they be best to contact you, and which, any links that you want me to share?
Oh yeah, so I am located here in Reno. Our practice is called Integrative Health Center International, and our number is 775-827-6696, if that's something that I guess for our patients. And then here in the US, I will send you some links where we can probably
Perfect.
connect for the international. But my email is melvin_nario@yahoo.com for any questions at all, and anybody who has queries. I'm always available. I always answer to students
Wow.
who I teach, and even doctors in the Philippines who I actually collaborate and I see patients through virtual. That's why always available for everyone who is actually seeking help, and also anything related to your health. I will always definitely be helping you out in the integrative way.
Oh, you're incredible. Thank you so much for sharing all that, and I'll put all those links in there. Thank you very much, Dr. Melvin. Really appreciate you.
Thank you, Lisa.